Okay, well, if you're holding one of these, chances are you had surgery, and this is your post-op bag. So let's go through what will likely be in it and how to use it. So this will be a general video. There may be some specifics to your particular operation, which will vary, but this will get you started for most things in terms of a post-op kit specific to um, wound and dressings and wound care. Okay. Step one, whenever we're going to deal with dressings or anything, we're going to wash our hands with an antibacterial soap before we start and when we're done. That's really important. Now, let's go through, let's talk about a tummy tuck, maybe a mastopexy, a breast lift, or a breast reduction, or something that has a longer incision. Chances are we're going to be using a combination. Now, the brands may vary, so if your kit doesn't have exactly this color box or whatever, then don't worry, but the materials will be the same. I try to simplify things as much as possible. This is an ABD pad. It's a gauze pad, and when we go to use it for dressings and whatnot, we're going to open it and we're going to fold it so that it fits length, along the incision. So we've taken our shower, we've washed everything, and now we're going to put our dressings on. We'll talk about those details, but in general, the kit will contain some ABD pads. It will have a real skin-friendly tape. Less is more, but it has a skin-friendly tape. I will also include an antibiotic ointment as well. So we'll put a little coat of antibiotic ointment over the incision, and then the pad, and then the tape. Next, in the kit, there will be we call it a DVT or sequential compression device. And these are, it's a device that is designed to squeeze the calves. We'll use a variation of this during your surgery. And then after surgery, we're going to ask you to wear this device pretty much around the clock, unless you're in the shower, until you are walking normally. Depending on the surgery, that may be a couple days, maybe a couple weeks. But I want you to keep wearing this until you're walking normally. It charges like a cell phone, so there's a little plug at the bottom, and you'll just plug it in. So if you're home, you can plug it in while you're seated, and then the battery goes for a good number of hours to keep you safe. Now, let's say you've done something that involves a smaller incision. Typically, in this case, we're going to be talking about a breast augmentation. You will wake up with a dressing that will be specific to that operation. After the first shower, we may ask you to take the dressing off, or if the dressing has gotten wet or stained, you'll take the dressing off. You'll wash the wound with soap and water, and then we'll just ask you to use a fabric band-aid. When it comes to using fabric band-aids, for almost all of my procedures, I'm going to ask you to do something specific, and that is, for the most part, I bet the cut will be longer than the white pad on a band-aid. You take the fabric band-aid and then take your thumbs and take some of the stickiness out of it so that when we put it on the sensitive areas of the skin, it comes off easy. You'll figure out with your oils whether it's 5 touches or 10 touches, however many touches it is, so that it sticks long enough to do what it's supposed to do, but not enough that it causes any discomfort when it comes off. That is what's going to be in your post-op kit. There may be a couple little additions or substitutions here and there, but that covers most of it. If you've got questions, please ask us. Take care.